Epilepsy is one of the most sensationalized and misunderstood diseases that plague many people to this day. The media and Hollywood has sensationalized epilepsy, making it look like a single seizure where you just drop and have a grand mal, and unfortunately, that is extraordinarily far from the truth. So today, we're going to go over all the types of seizures, different types of epilepsy that you or a loved one could have, and generally the symptoms and things to look out for and things you can do if you see someone having a seizure in public. Since it is very scary to witness one happen, my hope with this video is to give everyone a better understanding while also allowing you to make better decisions in public when that time comes. The first one we're going to talk about, this one is very common and also extraordinarily hard to diagnose. So in the case of generalized seizures, which is what we're going to mainly look at right now, a generalized seizure is when it affects both hemispheres of your brain at the same time. It's an electrical activity that causes the seizure. This can include absence, atonic, tonic-clonic, tonic-clonic, myoclonic, and febrile seizures. Loss of consciousness may be accompanied by some spasms, some stiffening, a lot of shaking, muscle contractions, or loss of muscle tone. The diagnosis usually begins with a doctor taking a medical history, and then they'll usually go with an EEG, MRI, and blood tests. EEG being the most common way to check on someone who has epilepsy. As is the case with all seizures and epilepsies, treatments calls for an individualized approach to each patient, may include medication or other therapy. The thing is, everyone seems to have different triggers when it comes to their seizures. Some people are triggered by video games or flashing lights, while other people are triggered by loud noises. It just depends on the type of person you are. So when we talk about the case of absence seizures, they're commonly thought of as petit mal seizures. It's kind of when you daydream and you just start staring off into nowhere. Most of the time that is just simply daydreaming, but for someone with epilepsy, these can often be absence seizures. So the person will have an absence seizure will typically stop moving and stare in one direction for 15 seconds or less. The episode resolves on its own, and though the person may not remember what happened during the seizure, their normal state of alertness it typically returns pretty immediately afterwards, so it'll almost feel like a loss of time for them. I also want to apologize if you hear like metal clanging in the background. My cat is dragging around its toy right by my desk. Then we have atonic seizures or drop seizures. A seizure of this type usually involves a sudden decrease in muscle tone, causing a person's body to go limp, slump, or collapse, possibly causing injury. Atonic seizures characterize certain epilepsy syndromes, such as Lennox-Gastaut syndrome. And these you're typically just going to see someone go limp and fall straight to the ground, almost as if they've fainted. Myoclonic seizures. Now this one I'm very familiar with, as my brother, who I am a caretaker for, has generalized epilepsy, and these are what he experiences. So this is characterized by sudden body jolts or increases in muscle tone, as if the person had been jolted with electricity. A myoclonic seizure of this type is similar to the single or multiple sudden jerks people sometimes experience as they are falling asleep, called sleep myoclonic. So this is kind of like when you lay in bed and all of a sudden you just have this burst, this jolt. That's what it is, except that's benign, whereas these can be quite harmful since the jolts kind of occur in bouts. Now, you can't have infantile spasms. It's a subtype of myoclonic epilepsy that typically begins between the ages of 3 and 12, and may persist 3 and 12 months, that is, and may persist for several years. Infantile spasms typically consist of a sudden jerk followed by stiffening, often the child's arms fling outward as the knees pull in and the body bends forward. Each spasms only lasts a second or two, but they usually occur close together in series. Sometimes the spasms are mistaken for colic, but the cramps of colic do not typically occur in a series. Infantile spasms are most commonly just after waking up or falling asleep. This particularly severe form of epilepsy can have lasting effects on a child and should be evaluated and treated as soon as possible. Then you have the tonic and clonic seizures. In a tonic seizure, the person's muscles stiffen and they lose consciousness. The eyes roll back in their head and muscles of the chest, arms, and legs stiffen, causing the back to arch. The contracting muscles in the chest make it hard to breathe, and the person's lips and face may turn gray or blue. The person may make gurgling sounds while struggling to breathe. In the case of clonic seizures, they cause a person's muscles to spasm and jerk. Muscles in the elbows, legs, and neck flex and then relax in quick succession. The jerking motion slows down as the seizure subsides and finally stops altogether. As the jerking stops, it is common for a person to let out a deep sigh before resuming normal breathing. Now, in tonic-clonic seizures, once known as the grand mals or convulsive seizures, this is what you would typically see in Hollywood or the movies. These are exactly what you usually see, not exactly, but the symptoms are pretty much as follow. They occur with tonic and clonic movements at the same time, and these are extremely scary. These are the ones that Hollywood likes to show off. Now, it's important to note that seeing a seizure can be extremely scary. It is, however, not true that a person having a seizure is in danger of swallowing their own tongue. That's not anatomically possible. But don't ever put anything in their mouth or forcefully open the tightly clenched jaw while the seizure is happening, as this could harm the person. What you typically want to do when you see someone having a seizure, the first thing you're going to do is you're going to secure their head, okay? Whether that be putting a blanket underneath it, a pillow, something, so that they're not banging their head on anything that can harm them. After that, you need to try to put them on their side. This is so they don't choke on their own spit, not so they don't choke on their tongue, which, like we said, is impossible. There's going to be some spit up. There's going to be some foaming. You want to roll them over on their side so that they don't choke on it. A seizure is usually lasts a few minutes or less, after which the person is likely to remain unconscious for a few minutes more, depending on the intensity of the seizure. This is the post-seizure or post-ictal period. And during this phase, the person's brain is extremely active as it tries to contain the abnormal electrical impulses and bring the seizure under control. So, like I said, you're going to make sure their head is safe. You're going to roll them on their side, which can be difficult, especially during a tonic-clonic seizure, because, like I said, there is the issue of, their body is spasming, but just try your best without harming them or pulling them or trying to force them into unnatural positions, right? As the seizure goes on, they'll start to calm down and you can move them onto their side a little bit more. Just wait for the convulsing to stop. That way you can make sure that you and the person you're taking care of are perfectly safe. During all this, you should be dialing 911 as well and letting them know that the person is having a seizure. And you're going to want to make sure that the seizure doesn't go over 5 minutes. Now, you can't necessarily stop it, but try to time the seizure if you see it start. You want to, the paramedics as well as the individual's doctor are going to want to know exactly how long it lasted. So you're going to have to keep that in mind as well. So the next type of seizures we're going to talk about is known as focal epilepsy. And this one is what's most interesting to me. So typically with focal epilepsy, the individual who has this has some level of awareness as to when they're going to have a seizure. Now, focal epilepsy starts in one section of the brain. It affects one hemisphere of the brain at a time. The cause of these is not yet known, but some research points to genetic component. That's the case with all epilepsy. It's all considered usually to be genetic. There are obviously some trauma associations as well, such as physical trauma. The person's brain and brain function may appear completely normal. You may never know that the person that you're talking to right now could have epilepsy. So just keep that in mind. There's frontal lobe epilepsy. So it's a term for reoccurring seizures beginning in the frontal lobe, the area of the brain that's right behind the forehead. Because it's the frontal lobe responsible for planning, executing movement, and personality, frontal lobe epilepsy can have a dramatic and sometimes terrible effect on the patient's quality of life. Frontal lobe seizures are often very brief, about 30 seconds, and they tend to happen most often at night, and they're typically simple or complex partial seizures and can quickly spread throughout the brain. Because there are so many connections between the frontal and temporal lobes, it can be difficult to determine which section of the brain is being affected. Typically in this situation, doctors' first line of defense would be to prescribe an anticonvulsant medication to treat this. Then you have your temporal lobe epilepsy. Temporal lobe epilepsy is a term for reoccurring seizures beginning in the temporal lobe, the section of the brain that's located, if you follow your fingers here, it's located on the sides of the head behind the temples and the cheekbones. So if you want to put your fingers right there, you can see exactly where that's located. The temporal lobes are the area of the brain that are most commonly give rise to seizures. The mesial portion or middle of both temporal lobes is important to epilepsy. It is frequently the source of seizures and can be prone to damage or scarring. Because of this, there are many diverse functions either in or closely related to the temporal lobes. These seizures may have a dramatic effect on them for the rest of their life, such as developmentally disabled, trouble paying attention, learning, things that can really affect them, moving forward with their life. The seizures that begin in the temporal lobes, they usually remain there, or they could spread to other areas depending on and if the seizure spreads. There are certain things that the patient may experience during this time, such as a peculiar smell, such as burning rubber, strong emotions like fear, abdominal and chest discomfort, automatic, unconsciously repeated movements, staring, and loss of awareness. Then we have the parietal lobe epilepsy. The parietal lobe is the section of the brain on the top and sides of the head known as the association cortex. The parietal lobe is responsible for connecting meaning to the brain's functions. It is here that the brain creates a visual image that sounds are recognized as words, and that the sense of touch is associated with our particular object. In some ways, the parietal lobe is where perception meshes with physical reality. Parietal lobe epilepsy is very uncommon. You're not going to see it often. Seizures starting in this area can cause sensory disturbances such as, feelings of extreme heat, some numbness, some electrical sensations, weakness, dizziness, hallucinations, distortions of space, among many other symptoms. And then the final one in focal epilepsy is the occipital lobe epilepsy. So this is a term for the reoccurring seizures beginning in the occipital lobe, the section of the brain in the back of the head that is primarily responsible for vision. Now, seizures in or starting in the occipital lobe are considered very rare. They can cause a person to experience flashing bright lights or other visual changes on the left side of his or her visual field if occurring in the right cortex, or on the right side if occurring in the left cortex. And this is just something to keep in mind. Now, like I said, not all people with focal epilepsy will be aware of seizures, but this is what's most interesting to me is they're said to have, they're called auras. So unfortunately, my brother, who has generalized epilepsy, he does not experience auras, but some patients have an unusual sensation of feeling. This is typically known as an aura that alerts them to an upcoming seizure before it happens. The aura is actually a simple focal seizure, which, like we said, that typically would start in the frontal lobe. And again, these types of seizures only affect a small part of the brain and only occur in one side of the brain. So typically when someone has an aura or they have these feelings, they're going to feel something like deja vu, impending doom, fear, euphoria, and less commonly, vision, hearing, sense of smell, and taste can experience changes, and they'll be a little bit off. So that to me is kind of the craziest thing about all this is, spending my whole life taking care of someone who doesn't have an aura. But knowing that auras are a thing is extraordinarily interesting to me. Now, obviously, the causes for seizures and epilepsy as a whole can, widely vary. So there's a difference between having a seizure and having epilepsy. Having a seizure is typically caused by an event such as alcohol poisoning, withdrawal from drug-related situations, extreme head trauma, and among so many other things. And those are typically one-off events, right? Epilepsy are people that have seizures be part of their daily life. There is no extreme trigger or anything like that. And, the causes of, these one-off seizures could be alcohol, drug use, head trauma, infections, strokes, brain tumor, and Alzheimer's. And then, like I said, people with epilepsy, they're going to struggle with genetic factors, progressive brain disease, conditions that are typically congenital or present at birth. So this is all good stuff to keep in mind. Like I said, there's so many different types of epilepsy, and they can be absolutely terrifying. So make sure you're doing your diligence, make sure you're paying attention, and make sure you're staying safe out there. I thank you so much for watching. I hope you enjoyed. I hope you learned something. Please like, comment, subscribe, do all that good stuff, and let me know what you want to hear about next. Epilepsy is something that is very close to my heart. So I wanted to make my next video about it. Thank you so much.